10th, 2020, regular but remote meeting of the Burlington Board of Health. It's been 9 months. Do you believe that? 9 months that we've been remote. And I have no idea when we'll be meeting face to face. Maybe some of my colleagues, Dr. Saltzman, would have a better idea, but I have none. Our board member, Libby Wallenjevitz, as she has done each meeting, will represent everyone in her reciting of the Pledge of Allegiance. Ms. Wallenjevitz.
Thank you, Dr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. I'm Ed Weiner, and I'm chairman, and individually here with my board of David McSweeney, who is vice chair, Dr. Wayne Saltzman, Libby Wallenjevitz, and Mary Beth Welch, who are members. And we are also happy to have Susan Luminello, who is our Director of Public Health, Christine Mathis, our environmental engineer, Sarah Kudamash, who is our Board of Health Administration and our IT host tonight, and Dawn Cathcart, who is our recording secretary. And we thank you all for being there. Last, I want to thank all of the BCAT professionals who work so hard to make this public meeting possible. As we have to do, Mr. McSweeney, Board of Health Vice Chair, will provide the legal retirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into the BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the phone at 408-418-9388. Meeting number tonight is 173-238-4190. Again, that's 408-418-9388. Meeting number 173-238-4190. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address. And as a reminder to all board members, all votes are required to be done by roll call. And with that, I'll turn it back over to you, Mr. Chairman. Ed, you're still on mute.
Okay. Again, thank you, Mr. McSweeney. Please note we're on BCAT and available for comments and questions through this video technology and by phone. Everyone, as I have said many times, remote meetings and chairing remote meetings are not easy. Preparation is many times that of in-person. Please understand we're doing the best we can. We have minutes from October 27th. Would you please take a look at them one more time? And are there any omissions, corrections, or additions? If not, is there a motion to approve?
So moved.
I have a motion by Dr. Saltzman,
Second.
second by Libby Wallenjevitz. All in favor? David McSweeney,
Aye.
Dr. Saltzman,
Aye.
Libby Wallenjevitz,
Aye.
and Mary Beth Welch.
Oppose.
She's you oppose, or do you?
Abstain.
Abstain. Oh my goodness. Yeah. Long.
Okay, you
long day.
abstain.
Abstain.
Okay,
Thank you.
I understand. You abstain. No one has ever opposed in 30 years. I was a little caught me off guard. Abstain, and I vote yes. So it's 4-0-1. Thank you all very much.
Thank you.
We're at citizens' time. Is there anyone who is on this call who is not on the agenda who would like to address this board? Sarah or Dawn, do you see anybody?
No additions that I see.
Thank you very much, so we can move on. Um, Last meeting, I said we're getting there, but things are changing. We clearly are in a viral upsurge. Although things are doing okay in Burlington, we cannot be complacent. The Board of Health must continue our many roles, as I've noted many times, as we focus on our primary duty, and that is to keep Burlington safe and well. We're one of the busiest organizations in not only this town, but in the Commonwealth. We continue to see never seen challenges. I want to, in my report, thank this board, its members, its professionals, as well as our Medical Reserve Corps, and everybody who has done so much for the town of Burlington. I would like to take the next school reopening update out of the agenda and move it to right now. Our board is in regular communication with the school committee chairperson, Christine Monaco, and is closely working with the Burlington Public Schools professionals. Tonight, we again have Mr. Patrick Larkin, who is the assistant of the superintendent of schools, to provide an update. Can I please have a motion to take this Burlington Schools update out of order?
So moved.
Second.
Motion by Mary Beth Welch, second by, I guess that was Dr. Saltzman. All in favor? David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye, 5-0. Mr. Larkin, with new state calculations that were announced last Friday, we are in the green. What are we doing right? What have we learned? And lastly, what can we expect new from the Burlington schools? The floor is yours. Thank you.
Thank you, Dr. Weiner. And again, I want to just start by thanking Susan Luminello for her ongoing support. Nothing personal. I know we both cringe when the other person's phone number pops up on there, like she sees I'm calling or I see she's calling, just because we know it could be another case. But honestly, we couldn't get through this without her support. So it's comforting to have Susan's support and all of you. So thanks for allowing us this forum to give the updates and for people to ask questions. Again, it's been one or two cases a week. I know we had an interesting situation at Pine Glen last week where we had a presumptive case or a probable case because of a rapid test that came back, and because we're being cautious to keep the spread out of our schools and we want to do everything we can to keep our schools open, we had made the calls and put a classroom on remote, and then by a couple days later, we were able to get the molecular test back negative and have the kids come back to school on Monday. But again, I can't say enough. My personal experience, when I've had to call families to tell them there's a positive case in your classroom, we're going remote. They're thankful. They're appreciative of our efforts. And again, this wouldn't be possible without the support of Susan and the Board of Health to do this, to have this in place, the protocols that we do have. So I just want to give my gratitude to the community. We had another interesting case this week where we had to close down a few classrooms at Francis Wyman because of one positive case. And again, parents were 100% thank you. We appreciate everything you're doing. And again, just to be redundant, that carries over to the support we have on the town as well. So I feel like we have a good system in place. I feel like our families are appreciative of the communication that we've had, going back to the templates that we created before we started school to be able to communicate when something does come up. I think we're in a good place right now, and I knock on wood that we continue to see very few cases inside of our classrooms. And to our knowledge, we've seen zero spread from a case within our schools. So we look forward to, again, moving ahead and going about our business. And I know the talk at the school committee level is even about what can we do to get more in-person learning happening in our classrooms as we move into January of 2021.
I'm unmuted now. Does anyone have any questions for Mr. Larkin? And again, I want to thank you so much. I called Mr. Larkin by Sunday night at 8 o'clock, hoping to get his voicemail, and he picked up. I just want to tell how committed he is to this community, and he picked it up, and I was very embarrassed, but he agreed to be on today. Does anyone have any questions?
Mr. Chair, if I could.
Please, Mr.
Yeah, thanks. And Mr. Larkin, thanks for attending again tonight. I know this is probably not on the top of your list of things to do on a Tuesday evening, so I appreciate that. Outstanding work and dedication to the plan. I think, as you know, I echo your comments that it seems like it's working. Every case is unusual, and again, it seems like, to reiterate, it seems like through the contact tracing, it's not spreading in the school. It's coming externally. My only comment or question would be, as we're approaching the holidays and the students are going to be out of school for 10 days or a week, and even over the long weekend for Thanksgiving, have you thought about what that might do as they spend time with their family and friends, and maybe quite possibly travel? And thought about things that you might be doing differently, and maybe you don't have an answer now, but just comments around what that January might look like in the schools.
I'm glad you mentioned the upcoming Thanksgiving break, and then after that, I know we have another break in December. We do have some guidelines. We mentioned to families, Dr. Conti and I have started a video update each Friday, so we've had 2 of those. We'll have another one this week, and please correct me if I'm wrong on this, but I think the Massachusetts guidelines for out-of-state travel ask people to get a test within 72 hours of their return to the state if they're going to a high-risk state. The problem with that from our standpoint in the schools is you could potentially leave Burlington get tested on a Friday in Burlington, go to a high-risk state and be involved in activities in a high-risk state, and then come back on Monday. If your test was positive from before you left Massachusetts, you could return to the schools. We're changing that a bit in our district. We are going to ask for people to get tested when they return to Massachusetts from a high-risk state. That's what we're asking of our families and our staff, that they would test on their return to Mass, not before they leave, if it is within that 72-hour window. I know other districts are even taking it a step further, and they're asking people to quarantine when they come back from a high-risk state or international travel. So again, ours is going to go, again, the Massachusetts guidelines. If it's a high-risk state, we're going to ask that people get tested upon their return to Massachusetts and wait for that positive, negative molecular test to come back before they return to our schools. And we'll be reiterating that on our video update and putting it in writing with a flow chart as well on Friday. So thank you for that question.
Thank you very much. Appreciate it. Thanks, Mr. Chairman.
Thank you very much. Does any other questions? Sarah, do you have any? Sarah or Dawn, do you have any calls? Anyone on the line who would like to ask Mr. Larkin a question? I know some are going to be watching, but clearly they didn't dial in for this.
There's nothing on Facebook.
Nothing on Facebook. Sarah?
I don't have anyone dialed in.
Thank you so much. Mr. Larkin, thank you so much. I don't want to keep you. I want to, in December, we'll need you again one more time this year. We really appreciate you getting on. I think it's very important that we hear good things from you, and we want to commit to helping you and helping your team do whatever we possibly can. Thank you for all that you do. And with that, you're welcome to stay, but thank you so much for getting on.
Thank you again. Just we couldn't do it without the support of the town, so in the Board of Health. So thank you all.
Thanks a lot. Right now, we're going to go to subcommittee reports. I'm going to ask the subcommittee chairman of our assistant director position, our personnel subcommittee, if he would like to put that off until the next agenda item,
Sure, that'd be fine.
which takes us right into discussion. Proposal for assistant director of public health position. We have had a subcommittee meeting. We've met multiple times with at least virtually with Susan. Just so you know, to put this in perspective, I have spoken to the town administrator, the chairperson of the school committee, members of Ways and Means, including its chair, and the chairman of the selectmen about this, and many others. So with that, please take it away, subcommittee chairman.
Thanks, Ed. So we did have a meet. Ed, myself, and Susan all met last week to talk about sort of the role if we were going to potentially hire the role. And Susan did a great job in bringing, she brought a task list of what everybody does in the office on a day-to-day basis, and then kind of the larger scale items, household hazardous waste, BVRC, all those types of things. And there was a litany of items that certainly even pre-pandemic was a lot for any department of the staffing that we currently have to do. We talked through what that role, that position would be, sort of in the immediate pandemic environment. And as I'm sure you all know, just because we get a vaccine doesn't mean that it stops for the Board of Health. It continues on. How do we administer potentially a vaccine? Who gets it first? How do we still do contact tracing as the cases still are not going to drop off to zero right after the vaccine gets released, obviously. So we still have this pandemic stuff that we need to do as a Board of Health for probably next year plus, or who knows how long. And as the cases get reported to Maven, that increases the workload there. But we also talked about what post-pandemic or post-normal, what the new normal might look like, and is there enough work for this position to be viable in long term? And certainly we talked through, once the pandemic kind of normalizes, we're going to start to see more restaurants open up. We're going to start to see the development within in the community start again, we think. And then the day-to-day stuff, the importance behind the MRC and BVRC, and how does that develop into a more front and center role in the Board of Health. So long story short, I think we left that meeting pretty convinced that this role is needed. Certainly Susan needs to stop working nights and weekends, and not that he's looking for accolades, but our chairman is working a full-time job as it relates to the pandemic today, and being our number one advocate out there trying to get support of the community. So we do feel, we left there feeling, and I know, Susan, I don't want to speak for you, but I feel like you felt you were in agreement that the role is needed, and there's certainly a lot of things that this person can pick up where you can start focusing on more of the strategy of what the Director of Public Health can work on. So I think we had a 2-0 vote. Coming out of the meeting, that we want to move forward the meeting. With the role, we started kind of crafting a job description and putting some formality around it and what the duties would look like. And we still have that draft going around. And I think what I'd like to see, Ed, and I'll defer to the chair on this, but I'd like to have you get your comments on that, and maybe we take a vote, because I think it's important that all board members weigh in on this, because it is important change in addition to the Board of Health staff.
Thank you, Mr. McSweeney. Thank you for doing this. You've done a lot of work on this project. I had a statement that I was going to read, but I think you covered it all. We have 5 individuals who are charged with so many roles in the Board of Health. And with that, our director is working weekends, nights. Many other people are working during times that they wouldn't necessarily have to work. The public health communicable diseases, all the education, the flu vaccines, the food establishments, the environment, remediating the town pollution, drainage, sewerage, licensing, permitting, everything we do, and now the development. We're going to see we already starting to see a huge change in the development and the flavor of this town. From this development, we usually see to redevelopment, as well as the importance that we're seeing with the Medical Reserve Corps. We heard today how much we do in the schools, and so many other COVID activities, and maybe, hopefully, within the next year or two, that we have a vaccine, and we don't know what that's going to take in this town. This pandemic's not going away, and we need to expand this department. Based on our meetings, I spoke to all of the individuals that we have, that I noted before, and talked to them about a special town meeting in December. I received a call from Amy Warfield that said, look, Ed, if you go out and get the signatures, and I'm sure we could get 10 signatures without a problem in a very short period of time, or the selectmen authorizing a emergency town meeting, and I have a commitment from the chairman of the selectmen of his support of this position, that it would take a minimum of getting the signatures, getting that together, votes, and on top of that, a minimum of 45 days before we could put together a special town meeting, and it would cost the town a fortune, as well as have to recruit all kinds of people and spend a lot of money to get the technology to do what we need to do. So Amy Warfield and I talked about it, and we came to a conclusion that it would be best for us to put this warrant together for the January town meeting, which would only be a week or two after when we've put everything together for a special town meeting. We get it all together, and the due date for that warrant would be December the 11th. And we put that on the January town meeting for discussion and for a vote and for authorization. Once we have everything together, though, we can start looking for individuals. And I would urge us to, as a group, once we get everything, all the I's dotted and T's crossed, we begin to look for an individual to do this job, and to get ready to hire someone. So it doesn't go until this summer. We want to get this person on board. So the first thing, I'd like to open this up for discussion, because that's where it is, under discussion. And once we finish, we need to take a vote, because quite honestly, if the board is not behind this position and behind this initiative, I can't see how we're going to go forward. So I just open it up to discussion. Please, who's first?
Ed?
Yes,
Mary Beth.
Mary Beth.
Hi. Thank you. So thank you to the subcommittee. I think David did a great job of capturing the need for this position. I think going into my third term, I've seen this position. It was already warranted for this position, so I'm all for it. I think, as we said, once we end what we think might be the end of coming back to some normalcy, there's, I'm sure, as Susan came in with her task list, many other responsibilities and duties that she could focus on, as David said, the strategy. Also, outside of this position, I think it will probably help us, Ed, as I've talked maybe just to you, but it'll probably help guide for the, position us for the next position, or positions that this staff could warrant. It's a small staff, so I think I'm all for it. Thanks. I think great job, David, covering and just kind of giving us that overview. So good job to the subcommittee. Thank you.
Thank you. Anybody else?
Mr. Chairman,
Please, Libby.
thanks on my behalf, or from my point of view, thank you for all the hard work you folks have done on this. I think it's an entirely warranted position. My question is it a full-time position or a part-time position?
This would be a full-time,
Okay.
non-union position.
Okay.
that would handle much of the day-to-day management within the Board of Health, leaving the leadership to our director.
That sounds like a very good plan.
And Ed, if I
think,
if I
Thank
may,
you.
Ed, Libby, that's a great question because we did talk a little bit about not necessarily part time, but getting there was potentially a way to approach of getting emergency funding without having to go necessarily this quickly in front of town meeting, and we can get emergency funding for this year and then go in front of town meeting next year. So we did talk about that, and I think it kind of relates to your part-time question in that Ed brought up during the subcommittee a great point in that if we're going to get a quality candidate, one, we're not going to get somebody quality that necessarily wants a part-time role, and number two, who's going to leave potentially another community to come to Burlington that has the expertise if the funding was only for a year, right? And it could be up in the air if we could get town meeting next year, and that's the reason why we think we should go in front of town meeting versus getting funds allocated to us just for this year. So it's a good question.
I very much appreciate that, and that's my view as well. Thank you.
So, Mr. Chairman,
Please.
so I concur with all of the other considerations for this position. You know, you and I had talked about this for a number of years when I was chair and you were vice chair, and the time didn't seem to merit an absolute demand, and I think the time wasn't right before. I think the time now is a time of crisis, and as long as we can affirm, through the need we have now, that once the crisis has ameliorated, that we will still have a demand for this position. And clearly, I think that it has led Susan to see a lot of potential from this crisis, a lot of opportunities that we may have moving forward out of this crisis. So I think the time is now ripe to make this position a reality.
There's one other piece here that I know we have not mentioned, and I was kicking it around yesterday, and it came to me. We're also leaving out the fact that, as Dr. Saltzman said about a month and a half ago, maybe 2 months ago, that racism is a public health issue. It's a public health disease. And I think that that's a piece of the role of this person would be. This person would take a leadership role in the town. This person would be sitting on some of those committees. And I think that this is another piece it's the right time to do this. Thank you, Dr. Saltzman. I think we've heard from everybody. Susan or Christine or even Sarah, would you like to make any comments? If not, I'm going to put this to a vote. But I want to hear from all our professionals.
This is Susan. I just want to comment on something that Dr. Saltzman said that did come up in the subcommittee discussion too, in that now is the time. This has changed a lot, and we're going to have to be thinking more on the lines of emerging infectious disease. So before this happened, the thoughts were starting in the emergency preparedness world, starting to talking about emerging infectious disease. That conversation is going to have to continue, but continue even more so. So the planning, the emergency preparedness planning needs to continue more than we did before. And this position will help with that. So I can imagine that we're going to be doing a lot more planning for emerging infectious disease and a lot more planning for this type of infectious disease, where before it wasn't even considered that you would have to do a drive-through type of emergency dispensing.
Thank you. Anybody else? So this is the first real formal meeting that we have discussed this other than our subcommittee. We will be back to you at the next meeting, just before Thanksgiving, to give you a more solid and a more finished presentation. We need to have this warrant article and backup by December 11th, but I think we really should shoot for December the 5th, which is that Friday. It will take all of us to put this together, to make comments. So please, if you have comments, please email them to Susan and she'll forward them to me. So please, if you have email them all to Susan. And lastly, I hope, and I'm going to ask you now, that if we decide to go through with this, and we'll know in a minute, that all of us commit to being at that town meeting. I think we all need to be there to answer questions prior to the meeting, after the meeting, and during the meeting. And all of us stand together on that stage. So look it up. I'm not sure what's the exact date of the upcoming town meeting in January, but exit off, please, to be there. So do I have anything else, and do I have a motion?
Mr. Chair, I offer a motion to, for the Board of Health to solicit a, what are we calling it? Assistant,
Associate Director of Public Health.
an Associate Director of Public Health position from the town of Burlington.
A second.
I have a motion and second by Mary Beth Welch. Any other discussion? All in favor? Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Ms. Wallenjevich,
Aye.
Ms. Welch,
Aye.
and I vote aye. That's 5-0. Thank you so much. Please make your comments to our director so we can incorporate them into a final report to you that will go to the town. Brings us
Mr. Chair,
yes.
I apologize. We have someone on the line. I'm not sure if they're just listening in or if they had any comments or anything, but we do have someone on the line.
Hi, it's Steve Moran. I'm just from Ways and Means. I'm the chairperson there. I'm just following what's happening. And unfortunately, I joined a little bit too late to hear most of the discussion around the position, but it sounds like you've come to the conclusion to move forward with it. And it seems like with the conversation I had with Ed, it seems like the right choice.
Mr. Moran, you are the chairman of Ways and Means, correct?
That's correct.
And everybody should know who you're a very important person in that community, the chairperson of Ways and Means. So, Mr. Moran, why don't you give me a call when you have an opportunity, or would you like me to call you to just give you a quick review of what we talked about?
Yeah, no, that would be fine. Generally, anytime tomorrow would be good.
I will call you tomorrow.
Yeah,
Very
sometime in the morning is probably best.
excellent. Thank you, Steve.
You're welcome.
And thank you for taking the time to join.
I'm sorry I was late.
We're in staff reports right now. First, the environmental engineer. Ms. Mathis, would you like to give us a quick summary?
Sure. Good evening, everyone. I just wanted to update you that I continue to respond to a lot of COVID-related complaints. They sort of have some central themes, one of which is mask wearing, another social distancing at all types of businesses. And we have some repeat complaints from a few businesses, but in large part the businesses are cooperating with us, and they're reaching back out to staff and reinforcing the rules. And as you know, the rules are ever changing. Over the weekend on November 6th, 7th, and 8th, we got about 12 updates to 12 different standards and governor's orders that all had to be reviewed. And then we get calls from the community and from businesses asking for our input and help in interpreting those new standards and rules. So that's been quite a focus. And then the other thing I wanted to highlight, and that I did attach to my report, is based on our household hazardous waste event that we had in September, I was asked by the Covanta Group, which is a recycling and hazardous waste collection group of local towns in Massachusetts, to do a write-up about our COVID, or our household hazardous waste collection event during COVID, because we were highlighted as one of the few communities that had actually held a full-scale exercise during COVID. And they wanted some input from us on how it went. A lot of other communities, several other communities have held household hazardous waste events, but they've done it by registration, and they've seen much lower numbers. And they were very impressed with the turnout that we had, and they were looking for a summary to provide to the members of that group. So if anybody has any questions?
Mr. Chair.
Please, Dr. Saltzman.
Hi, Christine. Thank you again for a great report, and I definitely appreciate all the calls and monitoring that you're doing. But I'm looking under a portion of your report, administrative. EDS flu clinic, provide communications in area 4 traffic control oversight. What was area 4, and what was the traffic control oversight?
So area 4 was the checkout. It was around the back of the building by the gyms, and it's where we had to hold people for 5 minutes to monitor them for any adverse effects. And so it was just communication and making sure that we had ample traffic area for people to sit and wait 5 minutes and tell them why we were holding them.
Oh, so there was no oversight. It was oversight of the 5 minutes that people needed to be there.
Yeah.
There wasn't an oversight of something not being done.
No, sorry.
Okay, got it.
I'm sorry about that.
Thank you.
I have a quick question, just a comment on that, and that'll be my comment for the evening. We all know, and I just like to commend Ms. Christine Mathis, our environmental engineer, to put together in a pandemic a household hazardous waste day, which drew over 500 families, is just admirable. We were busy all day. It was just, but to get the volunteers together, the Medical Reserve Corps together, to come up with a new scenario and coordinate with the police was just amazing. And the DPW, who did a fabulous job. So just another group of tasks that I think people forget how much goes on in this board. So I want to thank you so much for it.
Thank you.
Is there anybody else who has anything else?
Mr. Chairman, just
Yes,
one
David.
quick
Mr. McSweeney.
comment. Yeah, thank you. Or one comment or question, Christine. So, and you're right. The law, the rules or laws are constantly changing and fluid, and it's hard for businesses to keep up with it. But I think we talked about this in the past. I saw another complaint or investigation or whatever you want to call it on Lifetime Fitness. And I mean, it seems like the issue that's on there is pretty basic. It's too close. The workout rooms or stations are too close, and or they're not enforcing mask wearing, and this seems to be like I don't know. I don't want to make a number up, but certainly several, maybe close to 10 complaints coming from Lifetime Fitness. So I don't know if you talked with them recently over this last complaint. And Mr. Chairman, I think it's at a point where, because we had the issue even as the pandemic rolled out with them, that, if we get another complaint, and again, I'll leave it to your discretion, that we might have them come to the board or at least dial into one of the meetings so we can see what's going on and maybe help them. But I don't know, Christine, if you could talk about that particular issue, or Susan, I don't know if you have any comments too.
We have had several complaints, as have been noted in my report over the past few months. And I think they have a challenge there just due to the size of the facility and, the ability to monitor. their clients in all the different areas of their facility, but has been a repeat number of offenses. I don't think it's quite 10, but it's enough that we're monitoring it very closely, and we can do as the board chooses. If you would like to have them come,
Yeah.
if you want, I can do a summary of the complaints that all in one, so you can see the dates and the types and whatnot, and for the next board meeting, and then maybe that would help further a decision.
Yeah, Wayne Saltzman, I echo Mr. McSweeney wholeheartedly. I get, the board of health already has a reputation of being extremely fair-minded when it comes to its businesses and the regulations that we are mandated to uphold in order to make sure that our community is safe. So, yes, I understand that those agencies which oversee this pandemic are making changes frequently that are often difficult to keep up with. But the reality is, mask wearing, social distancing, and hand hygiene are the key elements. And we know that going to the gym creates a situation in which you are more forcefully exhaling. And we all know what happened at church with a bunch of people singing in a choir. So the risk for transmission is high. 165,000 new cases in our country over the past 24 hours. I think that if businesses don't have the ability to understand or enforce the regulations that the Board of Health is mandated to put forth, then I think they should come before the Board of Health and just explain and maybe allow us to work with them to see how we can make things safer for the community, because first and foremost, it's all about our community.
I agree. Thank you. Are there any more comments? If not, I'd like to entertain a motion to approve the environmental engineer's report.
So moved.
Second.
Second.
Again, motion by Dr. Salzman, second by Libby Wallen-Jevitz. All in favor, David McSweeney,
Aye.
Wayne Salzman,
Aye.
Libby Wallen-Jevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye. Thank you so much. Which brings us to the Director of Public Health. Now, the Director of Public Health has actually 3 reports. We'll go through them individually, but we'll vote on them together. And that is first, the Associate Health Inspector, second, the Health Agent, and last, her report, the Director of Public Health. So, as we go in order, does anybody have any questions from the Associate Health Inspector's report? I do not. Okay, we'll go into then the report of the health agent. Does anyone have any questions to our director about the health agent? I have one, and I think I have the answer, but I just want to confirm that. Susan, White Coconut Thai Restaurant adding sushi operations. That has traditionally come before this board, so we could explain and we could note to the proponent exactly how we feel about and how vigilant we are around sushi operation. Will that business be coming before the board?
I believe so. I believe they're on the next agenda.
Okay, that answers that. Thank you.
Well, but a question, Mr. Chair, if they aren't doing sushi rice preparation via the pH control that we oversee, and they're either using, I forget what the other means is, does that still mandate they're coming? And I don't know what they're using, but would that still mandate they're coming before?
Yes, before Before they can begin, they must come before. In fact, those are the questions that you and myself and other members of the board ask. As you
Yeah.
remember,
Yeah,
we
yeah.
once had a group here that didn't know what PA, well, I don't remember exactly what it was, but they didn't know how to use the instrumentation that they were supposed to be using. They had bought the instrumentation, and we need to ask those questions.
So it's a litmus test. That's what you're saying.
Whoa, that is oh my God,
Thank you.
that is fabulous.
Thank you. I'm here all night. I'm here all night.
So
Thank you so much. Try the prime rib.
That is the line of the night. All right. Okay, if there are any other questions for the health agent? If not, we'll go to the Director of Public Health report. Susan, do you like to highlight anything?
Yeah, I just wanted to review, I'm sure you probably all heard or know about, but the changes recently to the state's color coding system, the green, yellow, gray, green, yellow, red. It now takes into account the percent positivity. And if you fall into, and it's different for the size of the community. So if you're a medium-sized community that we fall into, right now we're in the green. That means that we have less than 10 average cases per 100,000 and greater than 10 total cases. So to get up into the yellow, we would keep that the greater than 10 average cases per 100,000, and we'd have to have a greater than 5% positivity rate. So right now, like Dr. Weiner had said, we are still in the green. We were in the yellow, and now we're in the green. And I'm not sure what we'll be in next week. I guess it depends more on what our percent positivity rate is for that. So that was one change that happened from the last meeting. And then we've also had some changes to the face coverings and changes to closing periods. So there's a mandatory closing period now for businesses, certain businesses. They have to close at 9:30 p.m. So restaurants are included in that. So if you sit down at a restaurant and you have placed your order and has served at 9:15, that's okay, but you can't sit down and place an order after 9:30. So everything has to kind of wrap up at 9:30 so that people can be out of the restaurant by 10 o'clock, which is the time period which is the stay-at-home advisory time period. So there are other businesses that are also included in that. One of the things that's included in that is alcohol sales. So gas stations, liquor stores cannot sell alcohol during that time period. And there are some other types of businesses included in that, but retail is not included. So retail stores can be open after 9:30 p.m. So those were the big changes that we saw or have seen recently with what's going on with the state requirements.
Yeah. And I just have to say, and it's my own personal view, as someone who reported to the community when there was just one confirmed case, and now we know what we have. I am concerned about this change of classification midstream for the reason Dr. Weiner already brought up earlier, and that's complacency. So while we've gone from over 115 communities in the red to I think now less than 20 communities are in the red, I do not think it should. I think we still need to be vigilant and understand, although that now that our town is green and surrounding towns are now yellow instead of when they were red, I think that we should definitely make sure we are vigilant and do not become complacent about this change. I'm very concerned about that.
I agree.
Go ahead, David. Sorry.
No, are you commenting on that, or are you moving on? Because I just have one.
But go ahead.
Yeah, no, I guess my question is who are the local boards of health supposed to be monitoring and enforcing this, 930 law or rule? No sale of alcohol at gas stations past that time. Like, who is it left to the local boards of health to enforce all those changes and rules?
It's
And
Samantha.
yeah.
Can I answer that, please? Because
Is it Ed, are you
Yeah.
are you enforcing and managing?
no, I want.
If Ed's enforcing, I'm closing at 9.
Oh, you gotta go quick. I just want to make a comment to this, and this has been a little bit pet peeve, and Susan is laughing, and that is this. If you look at all the directives, and I urge you to go on and I know you've done this, but just go back and review them one more time. When it comes to enforcement of everything, it's local boards of health and others. But local boards of health are the primary group is supposed to be actively involved in enforcement. Then clearly it's impossible for us to enforce everything. But that's what this governor does. He just doesn't speak to the Department of Public Health. He doesn't talk to anybody. He just comes out with this, and it's always the boards of health who, at least in name, have to enforce. Now, it's impossible. Our police departments, and we've had on these state calls, which I attend as many as I can, and Susan attends all of them, the president or the police chiefs association, and even all of the police chiefs in the region have said, we're not enforcing it. We have serious work to do, and I wholeheartedly agree with them. We're not going to enforce a lot of these minor issues. And I would rather have them protecting me than running around to make sure that at 9:31, no one's being served in a restaurant. But on paper, I guess we have some responsibility. Susan, I put anything wrong? Say anything wrong?
No, no, that's absolutely right. So we are responsible. Obviously, we cannot be everywhere all the time. So our enforcement is complaint based. So if we get a complaint about somebody being open past the time, then we will follow up with them and remind them what the requirements are. We did send out notices to all of the restaurants, just letting them know that this change happened and they need to comply with this. So, yeah, so like it is put upon the boards of health to enforce, and like I said, it's complaint based only.
Thanks, Susan. I did know the answer to that question, but I wanted to have it out there as a discussion point. So thank you. I appreciate that.
You see me go crazy.
Yeah. No, I think it was great you asked that, David.
I saw. I keep saying to Susan she needs to be deputized.
Yeah, but
maybe we need 2 more roles, not
I
just
was
one.
thinking, right, just to get those complaints from the that something's still open past 9:30.
Yeah,
In addition to not wearing the mask, but yeah.
There is there's at least one community that has now a COVID enforcement officer. So it's there.
Susan, Ed, I have a few questions for Susan
Please.
too. Okay, Susan. So the first one, and I apologize if this was discussed in the previous meeting. Have you had a lot of feedback from the clinic?
Yes, we have. So I still have to go through all the survey questions.
Oh, that's what I figured from the survey.
The after action report. But yeah, we got a lot of feedback from the surveys. I haven't had time yet to look at them all.
Nope, I'll look forward to seeing that. And then the second one probably kind of falls into one of the questions. It's just something I happened to see. I saw a communication that Santa's coming to the mall. Is it? I was just curious. Have they reached out to the Board of Health to follow? That just strikes.
Yeah. I had heard something that they wanted to put Santa in a bubble. So I think maybe
Oh, okay. That's,
So if it's
yeah, just,
COVID safe, I mean, they're not going to be able to do the traditional Santa type of thing. So
Yeah.
I think that they're trying to think outside of the box with how they're going to do stuff like that.
okay.
Side of the bubble.
So I can,
Yeah,
was that mall?
Yeah.
Yeah. I mean, I can follow up with them. I think initially they had come to me a while ago and said they wanted to do something where Santa was, had no contact.
And that's all I ask. What little I've read, it said that the areas would be wearing a mask where mandated, and to me, I thought all in, obviously everything inside, it's outside and inside. So just something I just wanted to bring forward. I don't want to burst, stop anybody from seeing Santa. I mean, I believe in Santa, so
Well, it would become troublesome if Santa tested positive and then we needed to know every kid who came in close
well,
contact.
I just thought of, I mean, just if the contact is close and it's not following, that's, I mean, that would be a hard tracing, wouldn't it? So just thought I'd bring that to you. And those are the only two, the survey for the clinic and Santa. I think that's it for me. Thank you.
Thank you. Libby, anything? Are you okay? Okay, I have a couple, and that is, where are we with our flu vaccine inventory? Are we all done? I know we're not, but I'm asking the rhetorical question.
So yeah, we have some flu vaccine left. We're holding by appointment only. So if anyone wants a flu vaccine, they can call the Board of Health office and make an appointment. We have certain days opened up for that. So we did advertise that. We put it on social media and put it in the local paper for anyone who wanted to get a flu shot. So they can call the Board of Health.
And last, Susan, we are blessed to have you. I know you were working weekends. I know you were working nights. I call you every Monday morning and say, did you work Saturday and Sunday? And you said yes. I call you the weekend of the I shouldn't say the death of a family member, and you were still working on emergency work for the community. On behalf of this board, on behalf of the town, I can't thank you enough. And that's all I have.
Thank you. It seems that the school cases always seem to happen on late Friday or on Saturday. They're always on the weekend. So usually it's and those are the ones that take the most time because kids seem to have a lot of contacts. So those can take a while. So one thing I did want to bring up too was the governor's realignment with these color coding system is also tied into new guidance from DESE in that they're trying to get the Department of Education, early and secondary education, where they're trying to get kids to be in school even in the hybrid model. And so the new requirements that came out from there, I don't think is going to affect us that much because even if a community is in the red, they want them to continue with the hybrid model. So even if we're in the red, we're doing the hybrid model now. So there was a couple of other things that in the DESE guidelines that I just wanted to, that prioritizing in-person learning. And it says if they're in the gray, green, or yellow are expected to have students learning fully in person if feasible. I think the key word is if feasible. I don't know how feasible it would be because we're trying to do spacing between kids and can't put too many in a classroom. So so those things I don't think we're really gonna be able to change as we move forward. But I think we're doing well now with the schools. And that's all I wanted to comment on there.
Thank you.
Currently now in the schools, we're seeing a lot of cases that come from home. They get it somewhere else and then they they come to school. So not so much we're seeing that in-school spread. If we had in-school spread, then I think it would be a different story.
Thank you. Anybody else? If not, I'm going to ask Steve Moran, our chairman of Ways and Means. Do you have any questions? It's an opportunity and a privilege to have you here.
I will ask them as I go along. I've been following along, I think, reasonably well, and I'm very appreciative of the efforts to keep the school kids safe. I always get a little nervous when my kid goes to high school on Thursdays and Fridays, but I know that all the safety precautions are there, and I'm very grateful for that. But I don't have any particular questions.
Thank you.
Thank you for asking, though.
You're welcome. With that, do I have a motion to approve the Director of Public Health's reports, plural?
Hello,
I didn't see who that was, please.
Libby?
Who made that motion, please?
Libby,
Libby Wallen-Jevitz made that motion. Who is seconding?
second.
A second by Dr. Salzman. All in favor? Mr. McSweeney,
Aye.
Dr. Salzman,
Aye.
Ms. Livin Wallen-Jevitz,
Aye.
Ms. Welch,
Aye.
and I vote aye, and that's 5-0. That is our agenda for this evening. Before I ask for a motion to adjourn, we have a tradition, and Dr. Wayne Salzman, would you like to exercise your tradition?
Thank you, Mr. Chair. You know, Dr. Weiner, vaccinations are on everyone's mind. We got some really interesting news regarding the Pfizer vaccine and its 90% efficacy. I would just urge everyone that we still need to do some more work and looking at the data and making sure, above all else, that this vaccine, whenever it comes out to us, is going to be safe. But in the meantime, there are two other vaccines that we definitely can entertain with confidence. One, of course, is the flu vaccine. And, you know, on average, every year, 45% of our population, only 45% of our population in our country gets the flu vaccine, 45%. So it's more important than ever. It's always important. It saves lives. And I would just urge our community members who are over the age of 65 to either look at their vaccination history for pneumonia. And if they don't recall getting a pneumonia vaccination, please call your primary care doctor and find out which of the two pneumonia vaccinations is the right one for you. And I would wholeheartedly say that the flu vaccination and the flu vaccination and the pneumonia vaccination for those individuals who should be getting pneumonia vaccination is just going to offer increased protection. And the reason why is that pneumonia is the most common second infection after getting the flu that that older adults may succumb to. So just take care of yourselves. Ask questions, and as always, everyone, you know, politics aside, Vice President-elect Biden really said it the best. Wearing a mask is not a political thing; it's an American thing. And we've talked about being good citizens. Please take care of each other. Wear a mask, social distance, and hand washing, hand washing, hand washing, please. And I thank you, Mr. Chair, for giving me an opportunity to step on my bully pulpit for a few minutes.
Just like a fiddler on the roof, your tradition. Very good. Do I have a motion to adjourn, please?
So moved.
Mr. McSweeney, who's second?
Second.
Second by Ms. Mary Beth Welch. All in favor, David McSweeney,
Aye.
Wayne Salzman,
Aye.
Libby Wallen-Jevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye. Thank you, everybody. It's 5-0. Thank you, everybody. Good
Thank you.
night. Be well, be safe. Any questions, feel free to call us.
Thanks, Ed.